of Doctor of Philosophy, PhD under the educational program AD 101 to Medicine. Dear colleagues joining online, can you hear us clear? Can you raise hand, please?
Yes. Yes.
Thank you. Thank you. Before we start the dissertation council meeting, please allow me to introduce the members of the council. 4 members of the dissertation council are permanent, and the remaining 3 are specially invited experts based on the dissertation topic. Dear invited members of the council, we express our gratitude for accepting our invitation and participating in today's meeting. First, let me introduce the permanent members of the Dissertation Council. I am Kapanova Gulnara Zhambayevna, Chair of Dissertation Council, Doctor of Medical Sciences, Professor, Faculty of Medicine and Healthcare, Al-Farabi, Kazakh National University.
It's difficult to hear. There are a big echo. Echo, yes. I don't know why. Sarah, you hear it very well, Sarah?
Sarah Bernardi?
Yes, I hear all of you. I hear you, Ali, with some removement.
Echo too?
Yes, it's not so clear from Ali, but from the Kazakhstan, everything is fine.
Maybe Professor Ahmad Alalari, you turn 2 devices, maybe.
Okay.
We apparently have 2 devices switched on online over here, so we'll try to switch the microphone.
Yes, maybe our phone and computer.
Maybe I have joined twice. Maybe that is the reason. I guess I have to do something here. Does nobody have any problems with the echo?
Yes, we hear you.
No, we don't have any problems with echo. So maybe only from your side, Professor. I can hear Gulnara Zhambayevna very well.
We just turn off the microphone on one of the simultaneous computers in our room, so it might be better right now. Do you hear echo at the moment?
Денис Владимирович, вас не слышно, микрофона не слышно.
I guess everybody should mute
the echo from you. Continue. Продолжаем, да?
You can go ahead, please. I would try to concentrate. No, I have a big echo, so I guess I have to disconnect one of my enjoyment. Sorry.
Okay, thank you. Deputy Chairperson of the Dissertation Council, Vinnikov Denis Vladimirovich, Doctor of Medical Sciences, Professor, Head of the Health and Environment Research Laboratory, Faculty of Medicine and Health, Al-Farabi, Kazakh National University, Scientific Secretary of the Dissertation Council, Karbaeva Elmira Bikbolovna, PhD Associate Professor, Faculty of Medicine and Healthcare, Al-Farabi, Kazakh National University, member of the Dissertation Council, Musajana Vajana Bakhtkireevna, PhD, Associate Professor of Department of Fundamental Medicine, Faculty of Medicine and Healthcare, Al-Farabi, Kazakh National University, online participation. The permanent members of the Dissertation Council are present in full. For this defense, the temporary members of the Dissertation Council were approved by Protocol number 31, date March 18, 2025, of the Dissertation Council established at Al-Farabi Kazakh National University for the group of specialties educational program AD 0101, 6D110 200 public health, AD1012, 6D110 100 medicine, AD10104, 6D100 400 pharmacy, and 8D1013 nursing. The following experts were approved. Lokshin Vyacheslav Natanovich, Doctor of Medical Sciences, Professor, Academician of the National Academy of Sciences of the Republic of Kazakhstan, under the President of the Republic of Kazakhstan, General Director of the International Clinical Center for Reproductology, Persona, Almaty City, Kazakhstan, Ali Al-Ahmad, Professor, Dr. Rerum Naturalium, Head of the section Oral Microbiology at University Medical Center Freiburg, Im Bryce Gao, online participation. Marata Izada Maratovna, PhD, Associate Professor, Department of Obstetric and Gynecology, #1, Astana Medical University, Astana, Kazakhstan, online participation. Professor Ali Al-Ahmad, can you hear now?
Yes, I can hear you very clear. It's fantastic.
Okay, thank you.
Yeah.
Thank you. Official reviewers have been appointed for the dissertation and are participating in the defense. Allow me to introduce the official reviewers. First, Minchisheva Yulia Alexandrovna, PhD, Head of the Department of Oral Surgery, Asfindyarov Kazakh National Medical University, Almaty, Kazakhstan. Second, Bernard Sara, Doctor of Dental Sciences, Associate Professor, Department of Life, Health and Environmental Sciences, University L'Aquila, Italy, online participation. I would like to express my gratitude to all members participating in the Council. At the Dissertation Council meeting, 4 permanent members and 3 temporary members of the Council, as well as 2 official reviewers, are participating. So offline 4 people, online 5, absent no, total 9 participations. The required quorum for holding the Dissertation Council meeting is present. Therefore, we have full authority to officially begin the meeting of the Dissertation Council. That concludes the introductions. We will now proceed. May we proceed with the meeting? Are there any objections? None. Any abstentions? No. Okay. In that case, I declare the meeting of the Dissertation Council open. We will proceed to the dissertation defense of Oralhan J for the PhD degree in the educational program AD1012 Medicine, entitled Oral Health Status and Adverse Pregnancy Outcomes. The doctoral research was conducted at the Department of Healthcare and Management, Health Policy and Management, Faculty of Management, Medicine and Healthcare, Al-Farabi Kazakh National University. Scientific supervisor of the dissertation, Zhurabekova Gulmira Atagulovna, candidate of medical sciences, associate professor, deputy chairperson of the Board for Science and International Cooperation, Kazakh Research Institute of Oncology and Radiology, Almaty, Kazakhstan. Foreign consultants of the doctoral work, Gan Van, MD, PhD, Professor, School of Medicine, Jinan University, Guangzhou, China, Dear professor, I hope I have pronounced your name correctly. The dissertation is being defended for the first time. All materials related to the dissertation have been sent to you. Dear members of the Dissertation Council, do you have any question regarding today's agenda? No, thank you. If there are no comments, we will proceed with the meeting. The floor is now given to the Scientific Secretary of the Dissertation Council, Elmira Bikpolovna, to present the documents from the doctoral candidates' attestation files, please.
Thank you, Gulnaz Jombayevna, dear Chairman of the Dissertation Council, dear members of the Dissertation Council. Oralhan J was born in September 1986. She completed her undergraduate studies from 2006 to 2011 at Xianjiaoding University, China, where she received a bachelor degree in dental.
Can you speak a little bit louder, please? I don't know. Do you have no problem in Italy with the voice?
Yes, the voice is a bit lower.
Yes, it's very
You can speak a little bit up with volume.
Yes.
Получается погромче микрофон сделать?
Нет, тогда нет.
Слышно?
Эхо дает.
Да нет.
Один надо выключить тогда.
She then pursued postgraduate education at Xinjiang Medical University from 2011 to 2014 and obtained a Master of Medical degree from 2000.
I'm so sorry, but I can't hear you from here.
I can't hear you also. It's very low, yes. I guess should be louder, yes, should be up.
She undertook doctoral studies under a state grant at Al-Farabi Kazakh National University within the education program HZ10102 Medicine. Regarding the main results of the doctoral dissertation research are reflected in 3 publications in international peer-reviewed scientific journal indexed in the Scopus database. In addition, 3 articles based on the dissertation research were published in journal recommended by the Committee for Quality Assurance in Science and Higher Education of the Ministry of Science and Higher Education of the Republic of Kazakhstan. Furthermore, 4 of abstracts and the posters presented in international conference. The following documents are presented in the personal file of Oralhan J. First, application addressed to the rector of Al-Farabi Kazakh National University for admission to the dissertation defense. Second, copies of diplomas of higher and postgraduate education. Next, copies of orders approving the dissertation topics and scientific supervisors. Next, copy of transcript confirming completion of the doctoral program. Next, dissertation in hard copy and electronic version. Next, abstract in 3 languages. Next, reviews of domestic scientific supervisors Jurabekova Gulmira Ataguluna, as well as the review of foreign scientific consultants Guang Wang. Next, copy of the minutes number 421, date December 3, 2025 of the expanded meeting of the Department of Health Policy and Management, approved by Vice Rector for Science and Innovation, Member of Board of Al-Farabi Kazakh National University, Margulan Kasenovich Ibrahimov. Next, list of scientific publications and copies certified by the Scientific Secretary of Faculty of Medicine and Healthcare Al-Farabi Kazakh National University. Next, conclusion of the Ethics Committee confirming the absence of violations in planning, evaluation, selection, conduct, and dissemination of research results, including protection of rights, safety, and the welfare of research subjects. Next, review of official reviewers, Sara Bernardi and Mitchova Yulia Alexandrovna.
Sorry, it's still very low, the voice, very different to the first voice. Would you please go nearer to the mic, and everybody else should mute his microphone in the PC. I don't know if you hear.
I hear very low voice, actually.
Very
I
low.
understood something, but I
Okay.
hear very low voice.
Okay, don't worry. She introduces all the documents
Yes,
that
okay.
are in
Yes.
file. Okay.
And the last document certificate from Center for Scientific and Technical Expertise on plagiarism check of the dissertation. The defense date official reviews and temporal members of the council were approved at the meeting of the dissertation council by protocol number 31, dated March 18, 2 and 26. All documents required by the regulation of the dissertation council of Al-Farabi Kazakh National University and the requirement of the Committee for Quality Assurance in Science and Higher Education of the Ministry of Science and Higher Education of the Republic of Kazakhstan, available in the personal file of doctoral candidate Oralhan J. All documents were submitted within the established deadlines. Thank you for your attention.
Thank you. Are there any questions to the scientific secretary regarding the applicant's attestations file? There are no questions. This will be recorded in the candidate's file. I propose that the documents be included in the file. The floor is now given to doctoral candidate Oralhan J to present the main provision of the dissertation. You are given 20 minutes, please.
Good morning, respected chair, distinguished members of dissertation council, honorable reviewers, dear supervisors and colleagues. Can you hear me well? Yeah.
Yes, I can hear you.
Okay.
It's a little bit low.
Low?
Yes, maybe turn the voice a little bit up or got nearer to the mic.
I agree. Little bit voice louder.
Yes.
Okay. Микрофон жақындатшы.
I'm wondering if it's depending on my age, because I am the only one who hear it very low.
Please, Oralhan J.
Okay, please allow me to present the findings of the research. As you know, preterm births remain one of the most serious challenges in maternal and neonatal health worldwide. Nearly one in 10 babies are born prematurely, and complications related to preterm births are a leading cause of death in children under 5 years old. Even when infants survive, they will face lifelong complications. The etiology are multifactorial, involving genetic, environmental, socioeconomic, and maternal health factors. However, one potentially modifiable factor that is often underestimated is oral health. Oral health has become a major research focus worldwide, with growing evidence highlighting the importance of oral systematic condition in oral health outcomes. This research is especially important for Kazakhstan, where improving maternal and child health is a national priority, and research on oral systematic health remains limited. Therefore, this study can help address an important knowledge gap and provide locally relevant evidence to strengthen maternal health policies and preventive strategies. This dissertation investigates whether oral disease contribute to preterm birth through interaction with maternal socio-economic risk factors and exploring underlying biological mechanisms. Regarding the scientific note of this research lies in being the first study in Kazakhstan to investigate maternal oral disease and preterm birth using an integrated multidisciplinary approach and advanced machine learning to identify early predictors. This study has clear practical significance because its findings may support targeted prevention strategies, strengthen collaboration between dental and obstetric services, improve early identification of women at risk, and promote cost-effective integration of oral health into prenatal care. As you can see from this slide, this study used a multi-phase mixed method design combining evidence synthesis, epidemiological analysis, and laboratory investigation. First, a systematic review and meta-analysis was evaluated global evidence on the association between maternal oral health and preterm birth. According to the PRISMA guideline, after comprehensive database searching, duplicated removal, screening, and full text assessment, reliable high-quality studies were evaluated using Newcastle Ottawa scale and including random effect meta-analysis to estimate the association. In the second stage, a multi-center hospital-based cohort of 3,000 pregnant women was recruited from prenatal centers in Atrau, Aktobe, and Florida between September 2022 and April 2024. Participants completed structured questionnaire, clinical data was extracted from medical records, and follow-up continued until delivery. After data cleaning, 2,235 women were included in the final cohort, which was used to identify demographic, medical, obstetric, socioeconomic, and behavioral risk factors associated with the preterm birth. The last stage within the cohort, a nested matched case control study, includes 270 women. Within them, 90 is diagnosed as spontaneous preterm birth and 180 gestational age matched term controls. This phase evaluated oral health status and presence of Fusobacterium nucleatum in saliva and placental tissue using clinical periodontal examination and qPCR analysis. Statistical analysis include the multi-regression and machine learning models in the final phase. In this slide, you can see clinical oral health assessment methods include DMFT, score evaluation, and periodontal status evaluation by WHO and the 2017 World Workshop on Classification of Periodontal and Peri-Implant disease and condition. Regarding the main result of the study, I will explain by phases. First, let's look at the result of systematic review and meta-analysis. The result of systematic review and meta-analysis as following, based on 29 studies including more than 1 million participants, mother with periodontitis has significantly higher odds of preterm birth with a pooled odds ratio 1.81. It means maternal periodontal disease as an important modifiable risk factor. Additional meta-analysis finding on dental caries and apical periodontitis infection, women with preterm birth had significantly higher GMFT score and apical infection rates compared with term control. These findings further support the role of maternal oral infection as potential contributor to adverse pregnancy outcomes. Move to the result of cohort. The study population generally show a low-risk behavior profile with high educational level, low smoking and alcohol exposure, and the majority being employed. Despite these favorable characteristics, preterm birth still occurred in approximately 12% of pregnancies, highlighting the need to investigate underlying socioeconomic disparities and the maternal oral health factors beyond the traditional lifestyle risk. The strongest predictor across all categories was previous history of preterm birth. Other significant factors include the prematurity, body mass index, teen pregnancy history, general maternal health, and self-reported oral health problem. These findings indicated that preterm birth influenced by multiple interrelated medical, reproductive, and oral health factors with some determinants varying by gestational age groups. Regarding the results of case control study, women in sample showed a statistical burden of untreated dental caries, periodontal disease with evaluated bleeding on probing, and unfavorable periodontal screening score. These results indicated that poor maternal oral health was common and strongly support its potential role as an important and modifiable risk factor for spontaneous preterm birth. Clinical examination frequently identified gingivitis, calculus accumulation, untreated dental caries, gingival bleeding, and periodontal tissue breakdown. Overall, gingivitis was observed in 52% of participants, while periodontitis affected 31% among periodontite cases. 25% were stage 3 to 4, indicating that both early and advanced disease were existed. Women with preterm more frequently had adverse obstetric histories, including previous preterm, miscarriage, and abortion, as well as low educational status. Clinically, the preterm birth group showed poor oral health with high rates of periodontitis, pain, advanced periodontal stage, and severe periodontal screening scores. In logistic regression, significant independent predictor of spontaneous preterm birth include periodontal disease indicators, previous preterm birth, miscarriage history, and presence of the Fusobacterium both in saliva and placenta. According to the machine learning model, the strongest contributor to higher predicted risk include oral pain, severe periodontal screening score, DMFT index, maternal age, previous miscarriage, and history of preterm birth. These findings highlight that oral health factors contribute substantially to prediction of spontaneous preterm birth. Oral health status, maternal characteristics, and spontaneous preterm birth were closely interconnected. As you can see from this picture, all of these three conditions share socio-economic disadvantages. Conclusion. Maternal oral diseases, particularly periodontitis, were consistently associated with an increased risk of preterm birth across systematic review, cohort, and case control phases. To implement this model in antenatal care, the first step is to collect routine data during antenatal visit, including maternal, obstetric, socio-economic, clinical, and oral health information. This data then can be entered into digital platform linked to the predictive model. The model would calculate and individualize the risk score for spontaneous preterm birth in real time. Based on this risk category, the system could provide decision support for clinicians, such as recommending closer follow-up, additional screening, or targeted preventive interventions. Thank you for your attention.
Thank you. Members of the dissertation council, do you have any questions for the candidate? Please, Professor Ali Ahmad. You have questions?
No, I have just given a action to the presentation.
Okay, good report. Okay. Жанна Бахтигариевна, please, your questions. Microphone.
Can you hear me? Can you hear me?
Yes.
Слышно меня, да?
Yes, yes.
Okay. So my first question is concerning your data. I think, if I remember right, in the slide number 15. Yeah, you're showing the analysis, multivariable analysis, preterm birth showed very, very, very high odd ratio, adjusted odd ratio. Yeah, the previous one. Previous. So алдындағы, yeah, also. Here you can, you're showing the odd ratio, yeah, like preterm is 68.62. How do you explain such strong effect? And plus the distribution is quite high. Could this be influenced by sample size or data structure or something overestimation? It's my first question, so I will ask questions one by one, okay?
Жбек, don't hear. Very bad here. Естілмейді.
Yeah, estimator.
Thank you for your question, Jana Bhaktiyevna. Regarding the very high odds ratio, which is in the history of preterm, we can explain from three aspects. Firstly, it possibly it is a true association. It is really associated with the preterm birth, is really strongly associated with historic preterm birth. Secondly, the sample size maybe affect the true association. While we just have a 90 90 spontaneous preterm births, and 180 term births. And thirdly, we can explain this fact that in one group, for example, in term group, the history preterm birth is very low, but in the case group, history preterm birth is very high. So we can test this real effect by large cohort study. Thank you.
Okay, thank you. So understood. Next question concerning your health indicating you used DMFB, if I remember, BOP test, PSR. Which do you consider the most practical and reproducible for implementation in routine clinical practice in Kazakhstan among these tests?
Okay, thank you for your question. Regarding the dental evaluation, DMFD, and the periodontal evaluation, periodontal screening and reporting, and the other periodontal charting, I think in Kazakhstan, when we implement the screening, the DMFT score and the PSR, periodontal screening and reporting, is more adaptable, because this is very simple procedure when we compare to the full mouth periodontal charting, because the full mouth periodontal charting require a very specific level, but the DMFT and the PSR, it is a very simple procedure. Even not a dental specialist can do that during the antenatal visiting.
Okay, thank you. So additional short questions concerning the Fusobacterium nucleatum you mentioned, yeah? Do you consider this bacteria as a causal factor or biomarker factor? And last question about your AI. How do you envision the practical integration of this machinery learning into the health system of Kazakhstan? Is it possible? Have you tried already? Are you using practically right now? So this is last two questions from me.
Okay, thank you for your question. Regarding the qPCR2 detection of the Fusobacterium nucleatum, we can say it is a biomarker. In this research, according to the international literatures, when we study the oral systematic association, the most studied oral pathogen is Fusobacterium nucleatum, and during this research, our main aim is whether there is an association between oral health studies and adverse pregnancy outcomes. We choose Fusobacterium nucleatum as a mechanical link to evaluate, if there is the biological connection, like the oral bacteria, Fusobacterium nucleatum. If it is can find from the placenta, it means the oral bacteria can transfer to the placental unit to cause preterm birth. It is the initial aim of this Fusobacterium nucleatum research. Regarding the machine learning model, machine learning model is as a AI machine. It is not used to complement, not replace the traditional statistical method, but it is what is the benefits of the machine learning model is because preterm birth is a complex multifactorial outcome involving non-linear relationship and interactions among obstetric, socio-economic, and microbiological and oral health variables. So machine learning model can better capture these complex patterns, improve predictive performance, and rank variable importance. By combining both approaches, the study achieves stronger epidemiological interruption together with more advanced risk predictions. Thank you.
Okay. Are you satisfied with the candidate's response?
Thank you so much. Yes, I'm satisfied.
Okay. Okay. Next questions. Aizada Marat, please.
Thank you for your presentation. First, my question, how were the study regions selected for inclusion for your study? What criteria were used for selection regions and perinatal centers? And what levels of perinatal care regionalization were included in your study? And were the preterm birth rates taken into account? Thank you.
Okay, thank you for your question, Professor Aizada Maratovna. Regarding the selection of study regions, we choose Aqtobe, Atrau, and Kızılorda. Because this study was conducted within a multidisciplinary clinical framework and fully complying with all ethical methodological standards. Why we choose these regions? This study was conducted under scientific grant by Ministry of Kazakhstan. So we choose this region because in perinatal centers of these regions almost include all polyclinics, all pregnant patients from all polyclinics in these perinatal centers. Like in other cities like Almaty and the Astana, there is a lot of perinatal centers, so it's very hard to collect all the preterm births. So we choose these three regions. Thank you.
Okay.
And what about perinatal care regionalization? What level?
Perinatal
care regionalization. In our country, we have 3 levels: first, second, and the third level. And what level of perinatal care regionalization you select?
Okay, thank you for your question. For this perinatal care, it's not included in our research aims. While this research is part of grant, not all part of the grant, so I personally performed standardized dental examination, coordinated data collection, and conducted the epidemiological, statistical, molecular, and machine learning analysis. All obstetric assessment, pregnancy management, and clinical decision making were carried out exclusively by certified obstetricians and gynecologists, while laboratory procedures were performed with qualified specialists. Thank you.
Are they satisfied with the answer provided by the candidate?
Okay, thank you. About the next question, how can you explain the proportion of extremely preterm and very preterm births, 14 and 15%? Because according to official World Health Organization data, extremely and very preterm births account for approximately about 15% of all preterm births. And could this distribution be related to the oral health status of pregnant women? Please.
Pick. Please answer shortly.
According to our results of our research, the oral health studies was significantly related with the moderate to late preterm birth. Regarding the very preterm birth and extremely preterm birth, other factors like history of preterm birth or gestational diabetes or other factors contribute to this, but especially oral health studies in our sample is associated with moderate to late preterm birth. Thank you.
Okay. Are you satisfied with the candidate's responses?
Yes, thank you. And the last my question, did you take into account the structure of preterm birth in your study? What proportion of preterm birth was spontaneous and what proportion were medically indicated preterm deliveries? Thank you.
Oralhan J, please answer briefly and concretely.
During the case control study, we just select spontaneous preterm birth according to the diagnostic criteria of the obstetrics and gynecologist. During the cohort study, we include all of the preterm birth type, no matter the spontaneous or the medically induced. But in the case control study, we just include spontaneous preterm birth.
Thank you so much.
Okay. Are you satisfied? Your questions?
Yes, thank you.
Your answer, okay. Next question from Professor Lali Ahmad, please.
First of all, thank you for your nice presentation, very good organized and prepared. The topic is actually very timely, and we have been working also with this topic in Freiburg, of course, regarding the oral bacteria which could be involved in preterm issues. My question is regarding your results on Fusobacterium nucleatum, which is actually very interesting term in the oral cavity. It's a most gram-negative bacterium in the saliva and the oral cavity, and it's connected to colorectal cancer and to some cancers in the oral cavity. So my question is, do you have found in the literature that we have some strains from this species which really have been isolated from placental tissue? Because I guess just to cite the molecular methods like PCR or microbiome analysis in finding Fusobacterium nucleatum in the placental tissue is not sufficient enough to just believe that Fusobacterium nucleatum could be connected to preterm issues.
Thank you for your question, dear Professor Ali Al-Ahmed. According to our result, we just detected Fusobacterium nucleatum from saliva. From saliva only 66%. From placenta only 24%. It is very low detection rate. So I think according to our results, we can say the Fusobacterium nucleatum is causing preterm birth because if we need to conclude like the Fusobacterium is the real cause of preterm birth, we need other deeper understanding of the bacteria. For this part, we just want to know if the Fusobacteria can find from the placenta, so we can initially associate, initially give a result. The Fusobacterium may be translated from the oral cavity. Maybe it is existing in the placental normal bacterial profile. So this needs a further investigation. Thank you for your question.
So I guess my second question is also connected to this topic. We need further research, and I'm wondering if we have enough data so far to just develop AI supported diagnostic tool for preterm. So I guess we have at first to define some required additional research on this topic. I guess we need really additional studies, including a huge number of patients. Look at the prevalence of H. pylori in the oral cavity. You will find more than 500 publications in PubMed, but it's still a controversial, endless controversy because we don't have the strains from the oral cavity. Why should the bacterium not grow on the agar plate if it's present in placental tissue or in the oral cavity? Unless I don't have these strains in my lab, I cannot connect them to such important issue like cancer or like prevalence in the oral cavity in the case of H. pylori, and like Fusobacterium nucleatum in the placental tissue. So my last remark or question is, which kind of studies would you recommend exactly for on this in this field?
Thank you for your question. I think, according to my knowledge, animal model will be suitable for the causal effect of Fusobacterium nucleatum. While there is a lot of literature, animal studies which inject the Fusobacterium nucleatum to the mouse, and in some result it can cause preterm birth. Thank you.
Okay.
Thank you.
Other questions? But thank you very much for answering my questions.
Thank you. Are you satisfied with the candidate's response?
Thank
Yes.
you. Yes.
Yes. Okay. Next questions from Professor Academician Lokshin Vyacheslav Natanovich, please.
Thank you very much. Before it was a lot of very. My question is, what is the difference between pregnancy of preterm birth between the group with peritonitis without any oral disease? And second one, at the same time, we know that the etiology of preterm is very different. A lot of factors, especially genital disease, microbiological factors. What is factors of premature birth have been excluded from your research? Thank you.
Thank you for your question. Vyacheslav Natanovich. Regarding the first question, difference between periodontal status of preterm birth and term birth. According to the clinical examination, the periodontal status of the preterm birth and the term birth, we can differentiate it from their levels. In term birth, there is also exists the periodontal inflammation, but their inflammation level is more lesser than the preterm birth group. In preterm birth, we can detect the patient. We can detect the periodontal tissue, periodontal inflammation in a higher level, like 3 to 4 stage, and with tooth loss and inflammation, redness. Regarding the second question, how did inflammatory background? For this question, at the design stage, we exclude women with chronic inflammatory or immune condition and with major acute infection at the time of examination. So some of the strongest source of systematic inflammation were removed already as the inclusion stage in the both study sets. In cohort and in case control. In both the cohort and case control studies, we systematically recorded major maternal condition that can create systematic inflammatory background such as urinary and genital infection, gestational diabetes, hypertension and preeclampsia, anemia, obesity, and obstetric history like previous preterm birth, miscarriage, and abortion. These variables were then included as co-variables in multivariable logistic regression and the machine learning model. So the association between periodontitis and spontaneous preterm birth was always estimated after adjusting for these systematic and obstetric risk factors.
Thank you very much. I have the slides. Thank you.
Thank you, Vyacheslav Natanovich. Are you satisfied with the candidate's response? Okay. Next question from Professor Vinnikov. Denis Vladimirovich, please.
I have a few very brief methodological questions. The questions that are related to methodology, basically. And the first question comes from your systematic review and meta-analysis, which was talking about the association of those risk factors with adverse outcomes in pregnancy. I've noticed that you use Newcastle-Waterbury scale for quality control, which is an important component of the meta-analysis and systematic review. But your data of this quality control is your appendix of your thesis, and that is appendix number A2. I've noticed that there are a lot of studies, by the way. I've noticed that most of those studies were scaled or rated as 3, 4, 5, so the quality was quite low to make statements about the association. There were just a couple of studies. In light of this, how would you estimate the quality of your evidence that you conclude from the systematic review, given that the overall quality of many studies was quite low? Do you recommend to conclude about the association that you found out with some caution? In brief, yes or no? How would you what conclusions do you make about the associations based on quite low quality, overall quality of Newcastle level scale of those individual studies?
Okay, thank you for your question, dear Professor Denis Vladimirovich. Regarding the quality of include studies in systematic review and meta-analysis, the study design is different. It includes cohort studies, it also includes case control studies. So when we regarding the level of the studies, the first level always RCTs, and second level cohort case control studies the third level. So we do a random effect to evaluate the oral health studies and its association to periodont preterm birth in our systematic review and meta-analysis. And a lot of study their diagnostic criteria is different, their study design is different. To make a good quality systematic review, it will require high quality studies like RCT, but regarding these RCTs is not feasible to this design is not feasible to make this type of study, but in literatures there is a lot of cohort and there is a lot of cohort studies and case control studies, but we can find the RCTs.
Okay, thanks, but we'll discuss that later during the discussion, right? The quality control of those individual studies, because that's an important, that's a vital component of all systematic reviews and meta-analysis, but we'll discuss that later. And I got, because we're running out of time, I've got only one more second methodological question related to your analysis of socioeconomic status. That's a very important observation, and that relates to a wide range of different chronic conditions, including dental diseases and so on. And this is so nice that you've examined the socioeconomic status of the participants, of pregnant women. So the question is, where does this analysis, where do the conclusions that you draw about the association of socioeconomic status with adverse pregnancy outcomes, what part of your research does it come from? Do you make these conclusions from your cohort study? Do you make this conclusion from your case control study? Or do you conclude that from the systematic review and meta-analysis? Where did you find the most apparent, the most appealing and crying association of socioeconomic status with adverse pregnancy outcomes?
Thank you for your question. Regarding the socioeconomic factors associated with pregnancy outcome, we conclude these outcomes both from cohort and the case control studies. In our cohort studies, most of the socioeconomic studies is not related with preterm birth. Just the house instability is related with the preterm birth. In our case control study, just the educational level of the mother is related with spontaneous preterm birth. While in cohort we include all of the preterm type like medical induced and spontaneous preterm birth, but in our case control study we specifically include just spontaneous preterm birth, while the medical induced preterm birth there is a lot of other condition related with this outcome.
Thank you. I am satisfied. Thank you.
Okay, thank you, Demiraj. Does anyone else have any questions? No? Okay. Are they Then let us proceed to the next stage. The floor is given to the scientific advisor, candidate of medical sciences, Associate Professor Журабекова Гульмира Tagulovna, to present her opinion, please.
My review as a supervisor. I am pleased to provide this review of Oralhan J, academic progress during her doctorate in medicine at the Faculty of Health Policy and Organization, Kazakh National University named Al-Farabi. As her scientific supervisor, I have closely observed her development and dedication throughout her studies and research, and I am delighted to highlight her numerous achievements. Oralhan J graduated from Xianjiao Tan University, China in 2011 with a degree in dental medicine. And in 2014, she completed a master program in medicine in Xinan Medical University. Since migrating to Kazakhstan in 2018, she has been working as a lecturer in the Department of Fundamental Medicine at the Faculty of Medicine and Healthcare, Kazakh National University, named Al-Farabi. The dissertation of Oralhan J is a comprehensive and independent research that explores the relationship between oral health and adverse pregnancy outcomes. The practical significance of the study is evident in its potential to improve prenatal care protocols by incorporating routine oral health assessment into maternal health screening. Notably, her doctoral research was completed under the grant project Clinical Genomic and Environmental Variable Approach to Preterm Birth. According to the question of Aizada Maratovna, we selected 3 regions. I would like to answer for this question. We selected 3 questions, 3 regions. It's Aktobe, Kızılorda, and Atrau. Joined with the ecological situation in that cities. Aktobe with situation with a high level of chromium. Kızılorda joined with the disaster of Aral Sea, and Atrau joined with gas production. And we choose only 3rd level perinatal centers in our research. During the doctoral studies of Jebek, she completed her theoretical courses. She demonstrated a strong understanding of complex medical concepts and consistently showed high academic proficiency. Her training was further enriched by her scientific internship at Zemirveys University. During this internship, she enhanced her laboratory skills by mastering extraction and PCR techniques to detect Fusobacterium nucleatum. Regarding the recommendation of Professor Ali Al-Ahmad, of course, we will continue our research with the Fusobacterium and select more samples, and we will work for improve our design with joint with the Fusobacterium. She demonstrated a serious and Jebek demonstrated a serious and delighted approach to clinical research, carefully analyzing observation results and reviewing a large body of scientific literature. So the candidate has fully met the requirement of the PhD program as stipulated by the Ministry of Education of the Republic of Kazakhstan, acquiring substantial expertise in conducting independent scientific research. Her interdisciplinary work not only advanced our understanding of maternal and fetal health, but also holds practical implication for improving prenatal care strategies. Thus, the dissertation is a completed scientific work with significant theoretical and practical value and can be recommended for defense to obtain the desired academic degree. Thank you.
Thank you, Jurabekova Gulmira Tagulovna. The floor is now given to the foreign scientific advisor, MD PhD, Professor Guan Pang, please.
Okay, so during Oralhan J's doctoral studies, she conducted in-depth research on the topic oral health status and adverse pregnant outcomes, and successfully fulfilled all requirements of the doctoral program. Her dissertation is of great relevance to both modern obstetric and dentistry, as maternal oral health is increasingly recognized as a significant factor influencing the pregnancy and the fetal development. In particular, the periodontal disease has been identified as a potential risk factor for preterm birth and low birth weight. The dissertation thoroughly examines the morphological and functional changes in the oral cavity under the influence of the systematic maternal conditions, providing the valuable insights into the mechanisms through which infections and inflammatory processes contribute to adverse pregnancy outcomes. A key strength of Oralhan J's research is the multidisciplinary approach, which including the social, clinical, and morphological analysis. She effectively utilized the clinical diagnostic biomarker and morphological research to assess the impact of the oral infections on maternal and fetal health, and successfully expanded the existing knowledge on the subject by identifying new aspects of the interactions between the oral microbiota and the placenta functions. So, Oralhan J actively presented her findings and independently authored several articles which were published in high-rate international medical journals. Her dissertation research resulted in a total of 5 publications. Finally, I have no doubt that Oralhan J will continue to make significant contributions to medical research and clinical practice. I strongly support her future advance and highly recommend her for any academic or professional opportunities in her field. Okay, that's all. Thank you.
Thank you, Professor Guan Pang. All opinions expressed are positive. Thank you. I propose to include them in the attestation file. Are there any objections? Please vote in favor. Please raise your hand. Against? Abstained?
We agree.
Okay, thank you. Are there any questions for the scientific advisor? Yes, no?
I will confirm that I have read the thesis and it's really very good prepared and written. And I can only affirm that this topic is very, very interesting for future researches. And I guess I would strongly recommend the acceptance of this thesis.
Thank you. Thank you. Okay, continue on the next stage. The floor is now given to the official reviewer. It is the head of Department of Oral Surgery, Arts-Findiar of Kazakh National Medical University, Mintisheva Yulia Alexandrovna, please. You have 10 minutes.
Good afternoon. So I will be brief, honestly, probably 10 to more, but respected chairperson and members of the dissertation council, allow me not to read the full review because here is 13 criteria and it was provided in advance and downloaded, and I hope you read this review. And I want to say a couple of words. The dissertation presents a comprehensive and multidisciplinary investigation of an important problem in modern medicine. The study addresses the association between maternal oral health and preterm birth, so integrating epidemiological, clinical, and microbiological approaches. So this topic is highly relevant both globally and within the context of Kazakhstan, where improving maternal and neonatal outcomes remains a priority. So I want to say that this project was founded by the Ministry of Science and Higher Education of the Republic of Kazakhstan. And the scientific novelty of the study lies in the integration of clinical, socioeconomic, and microbiological data, particularly the investigation of Fusobacterium nucleatum in both salivary and placental tissues. So the results confirm the significant role of periodontal disease as a modifiable risk factor for preterm birth and support the inclusion of oral health assessment in prenatal care. The dissertation has both theoretical and practical significance. It contributes to the understanding of oral systemic health relationships and provides evidence-based recommendations that can be implemented in clinical practice and public health strategies. So during the reviewing process, questions arose, but they don't diminish the value of the dissertation. And honestly, during the session of questions and answers, honestly, I found the answers because it was about implementation of machine learning and artificial intelligence in routine prenatal care in Kazakhstan. So at the end, the dissertation by Oralhan J titled Oral Health Status and Adverse Pregnancy Outcomes represents an original and valuable scientific work. The author demonstrates a high level of independence, applies appropriate methodology, and addresses an important interdisciplinary issue within maternal and oral health, and overall the scientific quality, coherence, and relevance of awarding the degree of Doctor of Philosophy to Medicine. Thank you so much.
Thank you, Mintisheva Yulia Alexandrovna. Oralhan J, you are now given the floor to respond to the official reviewer. Shortly, please.
Thank you for your recommendation, dear Dr. Yulia Alexandrovna. Thank you for your thoughtful, constructive, and highly valuable comments. And I sincerely appreciate your positive assessment of my dissertation as a comprehensive, multidisciplinary. In response to your recommendation, I will carefully review the PRISMA checklist and follow the diagrams. Clarify the research strategy, inclusion and exclusion criteria, study selection process, data extraction method, risk of bias assessment, and the synthesis of the result. Thank you once again for your careful review, your expert guidance, and your valuable contribution to improving the scientific quality of this dissertation. Thank you.
Yulia Alexandrovna, are you satisfied with the answer provided by Oralhan J?
Yes, I'm satisfied.
Thank you. Thank you. The reviewer's opinion positive. The floor is now given to the official reviewer, Doctor of Dental Sciences, Associate Professor, Department of Life, Health and Environmental Sciences, University L'Aquila, Bernardi Sara. Professor Bernardi Sara, you have 5 minutes, so you may focus on the main comments, questions, and your conclusion, as the full review is available on the university's website. Please. Dr. Bernardi, are you here? Professor Bernardi, I don't see you and don't hear. And maybe a scientific secretary read the review, please, shortly.
Hello.
Okay.
I'm so sorry. I have to go to lecture as I brought you.
Okay. We take 5 minutes to you. Yes. You may focus on the main comments, questions, and your conclusion, as the full review is available on the university website. Can you tell about your review, please?
Yes, I found the work of the candidates very advanced, as well as I care about focusing on women's health and to connect the oral health with the reproductive health in women. As I found out, we shouldn't left anybody behind, especially women. And so I was very moved, firstly for the aim, and in addition is a contribution that dental sciences can give to the global of the global health status of the women gender. And I found the methodology quite. I appreciated the structure of the methodology, that it was very precise, as well as the results presentation. So for me, there were just some minor English typo error, as I wrote in the review, and so I recommend to give the degree to the candidate of the doctorate, since I personally think that, given also the results from these works that have been also published, the candidate matured the status of doctorate, is worthy to have a doctorate title.
Thank you. So the reviewer has expressed a positive opinion Professor Sara Bernardi, thank you very much for your feedback. Oralhan J, you're given the floor to respond to the official reviewer.
Thank you once again for your grateful review, your expert guidance, and your wonderful contribution to improving the scientific quality of this research, dear Professor Sara Bernardi. About your question, recommendation, according to the review, machine learning is a computer-based analytical method that learns patterns from data and use them to predict outcomes. We selected variables that were clinically relevant, supported by previous literature, and easy to obtain during the first antenatal visit. So the purpose was to build a practical early risk model that could be used without expensive laboratory tests or complex procedures. Thank you.
Okay, Professor Bernardi, Sara, are you satisfied with the candidates?
I'm very satisfied for their precise answer from the candidate.
Thank you. Thus, our positive opinion has been received. The official reviewers we express our sincere gratitude to you. We now proceed to the discussion of the dissertation. Member of the dissertation council who would like to express their opinion on the dissertation, please. Maybe Professor Ali Ahmad. You can tell about it.
Yes. So, as I have already said, I was very impressed by the organization, by the comprehensive way how the candidate treated this very interesting topic, which actually is still unclear. And the candidate put all things together, all points together, which that have to do with this very, very important topic, as Sara Bernardi already mentioned. And I strongly recommend the acceptance of this thesis for doctoral title for the candidate. And I have learned a lot from the script of the candidate, also for my own research.
Okay, thank you. Who wants to next?
I would like to give a word.
Hello, please.
To myself, I meant. This is a very important piece of research, and it definitely deserves acknowledgement in the form of PhD. And that research was of really great value, and it's of vital importance for the whole Kazakhstan from the public health perspective, from the public health point of view, because that really addresses the important aspects of socioeconomic status of pregnant women as far as it is related to the adverse outcomes in pregnancy. Because we normally think then when we address the issues of dental health and dental status, we normally think that these diseases should be treated at some certain stage. But now we see that using this multivariate analysis that the candidate has applied, that socioeconomic status is one of the most important determinants of the adverse outcomes, and that has to be addressed even before pregnancy, because that can predict the adverse outcomes during pregnancy, and thus can really be a modifiable risk factor. But I'm still concerned a little with the interaction that may occur of the socioeconomic status with, such as your income, educational level, such as your, I don't know, background, with the diseases that you may have. Because one thing is the confounding that you addressed in your statistical analysis, right? Because you actually, in your multivariate analysis, you block the effect with the multivariate analysis. You block the effect of socioeconomic status when you want to elucidate the dental disease. But interaction of these two effects is really important. And we need to consider that socioeconomic status by itself and your dental conditions are so much collinear. So you are, once you do have the low socioeconomic level, such as low education, you're expected to have high risk of your dental conditions. So that aspect has to be further elucidated in further research, and the directions that you've shown really show us that when working with people going for pregnancy, planning the family, planning their pregnancy, we have to address socioeconomic determinants of their health so that to reduce further risks. So from that perspective, I also, from this epidemiological perspective, not only from the clinical perspective, I do consider this piece of work and this research of great value for Kazakhstan, and I will definitely go to support this PhD, and thank you for doing all this.
Thank you, Denis Vladimirovich. Who also would you like to express their opinion? Sorry, Professor Sarbinardi, please do not disconnect. You must vote later. Jana Musajanova, Professor Musajanova, please.
Can you hear me?
Yes.
What is impressing, the author performed really a big systematic review. She analyzed a lot of subjects, like including the molecular diagnostic also. This result obtains the practical significance, is developing the early like screening, prevention, the program for preterm birth in Republic of Kazakhstan, and using the well supported the AI, which is really impressive. So I believe that this dissertation deserved a positive evaluation, and the candidate is worth of being awarded as a PhD degree. So I completely support this work. Thank you.
Thank you. Thank you. And the next speaker, our Professor Academician Lokshin Vyacheslav Natановich, please.
First of all, thank you very much for the invitation to your conseil. It's interesting for me. It's my first experience here in Al-Farabi University. And today we participate in very interesting discussion about multidisciplinary disease, oral infection and premature births. And in my opinion, it's important because we know about the role of infection and premature births, but today we deeply understood that it's very important. And for us, it will be very useful to know about it, not only for member of Conseil, but it can be any methodic recommendation for obstetrician and gynecologist, for dentists, because influence oral infection for the preterm birth and the woman health during the pregnancy is important. And my proposal, my wishes, to think not only about one disease, because we are talking about health of women during the pregnancy, and oral infection can be influenced for the heart disease, for the hepatic disease. This is very important, and you have to continue your research. And my opinion that thesis and candidate deserve of award PhD and medicine. Thank you very much.
Thank you, Vyacheslav Natановich. Who next speaker? Maybe Azada Murat. Do you want to tell about your opinion? Please.
Yes, thank you. I agree with my colleagues, and this work is important as it addresses the potentially preventable and indefinitely studied risk factor in maternal health, and the study may contribute to strengthening integrated obstetric and dental care approaches aimed at reducing preterm birth in our country. Thank you.
Thank you, Aysata Murat. Who would you like to express the opinion also? No? Okay, dear colleagues, the discussion of the dissertation is concluded. We will now proceed to the secret ballot. The dissertation councils conduct a secret ballot to adopt the following decision. One, to award the degree of Doctor of Philosophy, PhD, or Doctor of Specialization. To return the dissertation for revision if the dissertation is defended in the form or a dissertation work. 3, send the dissertation for redefense. 4, refuse to award the degree of Doctor of Philosophy, PhD, or Doctor of Specialization. The dissertation is recommended for revision if the recommends are minor and can be corrected without changing the essence of the work. If the dissertation does not comply with paragraph 4 and or 6 of the rules and or only partially compliance with the principles specifies in paragraph 5 of the rule, except for the principle of academic integrity, then it is sent for the redefense. In case of violation of the principle of academic integrity or non-compliance with the principles of scientific novelty, internal unity, and consistency, decision is made to refuse awarding and degree of Doctor of Philosophy, PhD, or Doctor of Profile, including 2 official reviewers with voting rights and 3 temporary members of the dissertation council. A total of 9 persons participate in the voting. The scientific supervisors do not vote. The secret ballot is conducted is an online format. Each member of the dissertation council participates in the voting via the link sent by the scientific secretary. All right, let's begin the voting. Please, each member of dissertation council can see of your email.
Can you hear me?
You have to wait.
Yes.
Scientific secretary sent your email, the link
yes.
for the vote.
in English. So should
do you see link?
Yes, I have opened the link and I have approved my
Okay. Do you vote?
There, should I write my email address in it?
Yes, your email address. Scientific secretary sent your email address, the link for the vote. Yes, I voted.
The secretary would like to know if Sarah has just voted. Can we ask Professor Sarah if she just voted, because we cannot check it from over here.
Эльмира Бекболовна, я не получила ссылку.
Sarah Bernardi, Professor Sarah Bernardi. Turn on, please, Sarah Bernardi. You must vote.
Все, проголосовала.
Okay, thank you.
Потом училище сейчас говорит, что случилось, ты же не голосовал. А может, за Бина. Он так и не голосовал. Одного голоса? Да, там достаточно. Скажите технически, что у меня ресурс, он полетел, выступил еще раз. У нас на семинаре. А потом разговор случился. То есть там он в Корее отделал человека и не проголосовал. Да, было дело. Меня уже полчаса разговор. Так вы не дождетесь. Просто один голос не дошел. По техническим причинам. Ваш же сегодня полный был. Ну вот. Если один бюллетень, например, не вычеркнул, то все это недействительно. Недействительно, да. Она есть. На лекцию читает, она ушла, она читает спокойно. Но у нас также было последний раз. Он пускал сложно.
Mira Bibona, how many people voted? Eight?
We wait only one person. Сара Бернарди не отвечает. Скажем, это технически не проголосовал.
Hello?
Okay, you have to vote. Scientific secretary sent to your email a link.
Okay.
To vote.
Yes.
Please open the link and take your voice. We're waiting only you, Professor Sarah Bernardi. How many people waited? Elmira people now?
Гульнара Жамбаевна, мы ждем только одного человека.
Okay, Sarah Bernardi, do you see link?
Hi, Sarah. You got the link on the email. Can you please vote? Can you please vote? Already все помещаем. Давайте.
I'm sorry, may I disconnect?
Гульнара Жамбаевна, получили приглашение?
Yes.
Okay.
Okay. So sorry for these interruptions.
Okay, got it.
Sarah, can you please wait for 3 more minutes?
Okay, the meeting of the Dissertation Council continues. Yes, continues. The floor is given to the Scientific Secretary, Elmira Bikovna Kardbayeva, to announce the results, please.
Thank you, Gulnara Jambаевна. Results of the secret ballot on awarding the PhD degree to Oralhan J. First, to award the degree of Doctor of Philosophy or Doctor of Specialization, 9 votes. Second, return the dissertation for revision, 0. Next, send the dissertation for defense, 0. And 4, refuse to award the degree of Doctor of Philosophy or Doctor of Specialization, 0. As a result of the secret ballot, all 9 members of the Dissertation Council voted in favor.
Thank you. Members of the Dissertation Council, we will now approve the minute based on the result of the secret ballot by open voting. Please vote. Those in favor? Any against? Any abstained? Okay. The minutes are unanimously approved. Members of the Dissertation Councils, before announcing the Council resolution, let us briefly discuss the classification or characteristic of the dissertation that have been distributed to you. 1. Nature of the dissertation results. 1.1 New solution to a problem of significance for the relevant fields of knowledge. And 1.2 scientifically grounded technical, economic, or technological development, ensuring the solution of important implied tasks. 1.1. Do you agree? Okay. 2. Level of novelty of the dissertation results. 2.1. The results are new. 2.2. Certain results are not new. 2.3. Significant part of the result is not new. 2.1.
2.1.
Okay, thank you. 3. Significance of the dissertation results. 3.1, very high. 3.2 height. 3.3, considerable. 3.2?
Yes, 3.2.
3. Okay, thank you. For relationship of the dissertation topic with plant research, 4.1, the topic is included in a state program or international research program. 4.2, the topic is included in sectoral programs, plans of scientific academies and scientific or scientific production organizations. 4.3 initiative research work. I know that it's work. Do you have program specific financial project? Yes. 4.2.
Correct.
Yes. Okay. Thank you. 5. Level of implementation, use of dissertation results with applied significance. 5.1 at the interstate level, license sold. 5.2 applied across sectors, and 5.3 applied within one sector, and 5.4 applied within an organization enterprise. I think 5.3. Do you agree? Thank you. 6, recommendation for wide application of dissertation results with applied significance. 6.1 require wide application, and 6.2 does not require wide application. What? 6.2?
Yes, 6.2.
Thank you. Thank you. In accordance with today's agenda, have any unofficial opinions of the dissertation been received by the dissertation council? Elmira Pikbolna.
Thank you, Gulnaz Rambayevna. On the Dissertation Council's internet research, the following material regarding the official defense of the doctoral candidate were posted on 1 month before the defense. First, an announcement of the upcoming defense indicating the temporary members of the Dissertation Council and the official reviewers, as well as the form of presentation of the dissertation, venue, date, and time. Second, the electronic version of the dissertation. Next, abstract in Kazakh, Russian, and English languages. Next, the list of the doctoral candidate publications. Next, the opinions of the scientific advisors. And the last, the reviews of the official reviewers. No comments or suggestions were received.
Thank you, Elmira Pikbolna. Dear members of the Dissertation Council, please allow me to announce the resolution of the council meeting decision. The dissertation work of Oralhan J submitted for the degree of Doctor of Philosophy, PhD, and the educational program 8D 1012 Medicine, entitled Oral Health Status and Adverse Pregnancy Outcomes, has been prepared in accordance with the rules for awarding scientific degrees of the Committee for Quality Assurance in Science and Higher Education of Ministry of Science and Higher Education of the Republic of Kazakhstan, based on the public defense, scientific discussion, and the result of the secret ballot. The Dissertation Council established at the Al-Farabi Kazakh National University was a group of specialties, educational program 8D 101, 6D 110 200 public health, 8D 1012, 6D 110 100 medicine, 8D 1014, 6D 110 400 pharmacy, and 8D 1013 nursing, decided to award Oralhan J the degree of Doctor of Philosophy, PhD. Are there any remarks regarding the work of the Dissertation Council? No, thank you. Dear members of the Dissertation Council, dear colleagues, and guests, we have now reached the conclusion of today's dissertation defense. The Dissertation Council has made its decision based on the results of the public defense, scientific discussion, and secret ballot. Once again, we congratulate Oralhan J on the successful defense and the awarding of the degree of Doctor of Philosophy, PhD. Before closing the meeting, I would like to invite Oralhan J to deliver concluding remarks. Please, Oralhan J.
Thank you. First and foremost, I would like to express my sincere gratitude to Al-Farabi Kazakh National University, especially the rector and the administration for giving me the opportunity to pursue and complete the doctoral program.
Thank you. Thank you all for your participation. I now declare the meeting of the Dissertation Council closed. Thank you. Thank you for all.